Hello all, welcome back to the Biodocs channel. So today I'm introducing you all with the accessory glands of the male reproductive system. So as you all know that the seminal vesicles as well as the prostate gland here along with the bulbourethral glands are being called as accessory glands, which are secreting semen and the semen with the different compositions, which will enable the survival of the sperms till they fertilize the egg of the female reproductive tract. Okay, so we are going to learn today about the seminal vesicles, the prostate gland, and the other, which are a pair of small glands present, which are going to be the bulbourethral glands. So these are the ones today that we are going to deal with. So what I'll do is let me take up the topic detailedly speaking, considering about your NEET examination. What are the points which are to be remembered by you all that I'll be discussing today in this particular topic, okay, in the video. So the first thing that I'll be talking about is going to be the seminal vesicles. So the pair of seminal vesicles. What are these seminal vesicles doing is they are going to secrete the 60% of the total volume of the semen secreted by the male reproductive tract. So this is very important, children. It's a major portion of the semen is being secreted by your seminal vesicles, and most of the secretions are going to be very sugary, especially the seminal vesicle semen is going to be a very sugary fluid. Okay, this is very sugary just because of the presence of the fructose. This fructose is going to act as a respiratory substrate. It's going to act as a respiratory substrate for the cellular respiration process, carried by your sperm, okay, for its motility, for its survival, okay. So this is going to be the fructose utilized by it. And besides this, children, they are even going to have prostaglandins. They have prostaglandins, and prostaglandins are known to produce the contractions, okay, contractions, or what we call as spasms, both in the male as well as the female reproductive tracts. In the male reproductive tract, you can see that during the sexual orgasm or sexual arousal, we see that the prostate gland during the sexual arousal, the prostate gland gets filled up with the semen and the sperms, semen as well as the sperms. So this gives a filled up emotion for a male during a sexual arousal. And after that, what happens is the ejaculatory ducts which are running through the prostate gland are going to be constricted, or what we call as contracted, such that there will be ejaculation process, that is release of the semen and sperms out of the penis. So this is going to be that particular prostaglandins which is helping in the contractions, okay. So nextly, what we are going to have is they even have an protein called as fibrinogen. So remember, children, once the ejaculation is being done into the vagina, the fluid semen should not squirt out or should not be leaked out of the vagina. So it has to be clot. So just after the ejaculation into the vaginal area, the semen has to get clot. Okay, the semen has to get clot. So for that reason, we have this particular fibrinogen, such that the semen along with the sperms will not be moving out of the vagina. So this will prevent the fertilization process. So to enable and ensure the fertilization, we should have the mobilizing the sperms released out, and this should not leak out. So we have this fibrinogen which will be converted into a fibrin form, and this is going to enable the clot of your semen. clot of your semen, and this is being catalyzed by one of the enzymes, and that enzyme is being called as fibrinogenase. So these are important points that you need to remember about the semen of the seminal vesicles. Also, your accessory glands are releasing a fluid called as semen. So these are the compositions here. Nextly, when we are talking about the prostate gland, so the prostate gland here is just below your urinary bladder, where you can see that this is going to be the prostate gland. You can see that the ejaculatory ducts are moving in and they are moving out over here. So the thing that you can remember is the prostate glands are also, that is prostate gland is also secreting the semen, and the main composition of this particular semen is going to be the uh, citric acid they have, as well as they have lots of mineral ions, like they are going to possess calcium, they have sodium, they have potassium. These are the things, and especially the semen is helping in the lubrication, as well as they are going to be the media for the survival of sperms. Okay, so they are going to be the media for the sperms to move and to swim. Okay, so this is what is about the prostate gland. As I told you that during the sexual arousal, the prostate gland gets filled up with the semen as well as the sperms, which gives that sensation to the male during the sexual arousal. And next, coming on to the third one that I'm going to talk about is going to be your bulbourethral glands, or what we call as Cowper glands. Okay, so we have bulbourethral glands, or what we call as Cowper's glands. Okay, these are named after the anatomist Mr. Cowper. Okay, and these are very much homologous to, they are very much homologous to the Bartholin's glands of the female reproductive gland, Bartholin gland of your female reproductive tract, which is going to actually perform lubrication of vagina during sexual arousal. Okay, that is vaginal canal during sexual arousal. So these are the points that you need to remember. Now, speaking about the Bartholin's glands, what they do is they are secreting a alkaline and a very sticky mucus-like, sticky mucus-like fluid they are going to secrete. And the most important thing here is this particular alkalinity. What it does is, if you remember the urethra, which is being called as urinogenital tract, the urethra is a what you call is the common passage for the urine as well as the sperms. So now what happens is the acidity of the urine will be destroying the sperms. So what we need to do is, now we need to neutralize this particular urinogenital tract. So what happens is this alkalinity is going to act on the acidity, and it's going to result in the neutralization process. So it is going to neutralize such that you are saving your sperms from the acidic nature of the urine which is present in the urethra. So this is the most important function of your sticky mucus alkaline fluid. And the other thing what it does is it is going to intensify the sexual arousal. As the ejaculatory ducts are going to be contracted, the semen along with the sperms move down, and further the bulbourethral glands are going to add up the mucus sticky fluid and gives a more filled up sensation, which is going to be called as a intensification of the sexual arousal. So these are the three different glands of the male reproductive system, which are trying to pour up their secretions called as semen. And this is going to act as a lubricating fluid, as a nourishing fluid, which is providing them the a chance of survival, as well as they're also seeing that there will be a successful fertilization by not leaking the fluid semen out, but by clotting it as a clog inside the vaginal tract. Okay, so children, I hope you all have understood this particular procedure. So before I end up, let me once again show you all the slides of the three of these accessory glands here, such that it will be easy for you all for remembering. So this is bulbourethral glands which are pouring up. So you can see this is your prostate gland and the seminal vesicles, the ejaculatory duct. So all three togetherly pouring up the semen, giving up a filled sensations during the before the ejaculation process. So you can even see I have given you here, like it is adding up an alkaline secretion, okay, that helps the sperms to live longer, and the acidic nature of the urethra will not kill the sperms. Okay, and coming on to this particular image now, this is going to be the bladder, and you're having this particular prostate gland from where the ejaculatory duct runs, and these are the seminal vesicles which are being present. Okay, so the seminal vesicles, and you can see the bulbourethral glands over here, bulbourethral glands. So you can see the seminal vesicles, the prostate gland, the bulbourethral glands togetherly in one of the image here. So these are the ones which are togetherly pouring up the semen and giving a media for the sperms to move. Okay, children, I hope you all have understood, and this video might be helping you in your examinations. So if you like this video, do please hit the like button and try to subscribe my channel, and do please comment in the comment section how you liked it. I'll be making further more videos regarding the syllabi of your NEET. I hope you all will be liking them, and try to please share my channel with others too. Thank you all.